Welcome to the University of Liverpool, the original red brick, the original planning school, and original research. Hello and welcome to this Planning in Environmental Assessment and Management interview with Professor Thomas Fischer. Thomas is an expert in impact assessment, and recently he's been writing a retrospective analysis of 2 health impact assessments. So Thomas, thank you for joining us today. What led you to do this research?
Thank you, Richard. Well, I've been working on impact assessment for the best part of 33 years now, first in practice and then later also in research. So what I'm talking about here today, this is part of like many, by now, years and over 3 decades of activities in the field. So very often research that is done in the area of impact assessments are instruments that help decision makers to understand impacts of policies, plans, programs, and also projects. And there are different types of impact assessments. There are environmental assessments, that's sort of the original type of impact assessments, but over the last 30 years other impact assessments have been added. Social impact assessment and also health impact assessment. We have a World Health Organization collaborating center on health and impact assessments here. So a lot of my research over the past now 15 years has been on health and how health is considered in impact assessments. So this is therefore part of this wider story, really. The research that I want to briefly talk about here was done for what was at the time Public Health England, and it was a follow-up of a bigger project which was triggered in 2019 based on the Health and Social Care Act from 2012 and also the National Planning Policy Framework from 2012. Local authorities were given responsibility for improving the health of the local population, and hence they were looking for ways of including health in their activities. There is also what is called health in all policies approach, but health impact assessment is seen as the best tool there is in order to support the consideration of health in plan making. Now, in 2019, we started with a project where we looked at how health impact assessments are used by local authorities in England. Up to that point, it was totally unclear how many were, for example, produced a year, what they were focusing on. So this was a systematic review of all health impact assessment practices in the, well, it changes all the time, but about 325 local authorities in England. So we found a lot of practice. We found that on average there's at least 100 HIAs being produced every year in England. And we identified good practice, and that was great. But what we were looking at was the processes of those impact assessments, how they worked, how people were involved in them, what the reports looked like, whether they were of a good quality. So we were looking at the front end. So it wasn't so much looking at the actual effects they had on the ground. They had an effect on plans. Plans changed on the basis of them. But what does it actually mean, for example, for deprivation? Is there less deprivation after 10, 15, 20 years? Because of the HIAs, of course, that's very complex and very often it's very difficult to say what is the cause and what is the effect. But we identified 2 good practice cases that preceded those 2012 reforms, because HIAs were already done for longer than that. From 2007 and 2009, one on Cranbrook Newtown, which is a new town in Devon for up to 20,000 people. And the other one was an estate in Luton, Marsh Farm Estate, with 10,000 people and the regeneration of that. And these two HIAs, a lot of the people we had talked to in our earlier project referred to these as examples of very good practice. So we knew they were perceived by the people that were involved at the time as good practice cases, but we didn't know what they actually did. And because they were prepared, nearly 15 years earlier, we thought it was a good point in time to look at what the actual impact would be.
Great. So you took those two examples, two case studies, very different examples of development and regeneration activity, and you looked at the HIAs to look at the effectiveness, and your research found?
And our research found, well, first of all, we did a range of interviews with people that were still around, that were involved in the original HIAs. And at first we were slightly disappointed because they had lost track, and they said, yeah, they were really good impact assessments. We had representatives from public health, we had representatives from the communities. There was a lot of enthusiasm at the time for them. But then, in particular, in both cases, people said the financial crisis happened, we lost track, we don't really know what happened. They had, for example, health codes that were supposed to be implemented. There were ideas for long-term monitoring programs. There were things that actually were easy to monitor. For example, a community center, a school, a new school that was supposed to be open for other activities so that the community could come to that school, shopping center, a new town hall, with a new council that should be elected, and things like that. But the people that were involved at the time were slightly negative in that they said, we lost track, we don't really know what happened. And that was that. At the time, it was the height of the pandemic, 2021, when we did all the interviews. We sort of left it there, and actually we didn't publish anything initially. And then the person who was our client at Public Health England, a year later, he said to me, Thomas, now that the pandemic is over, please have another look at what we did and whether we can sort of do something with it so that we can publish something on two good practice cases. And what I then did at the time, I thought, okay, so people had said, oh, we lost track, the monitoring programs didn't really work. I went back to both cases and I followed up what had actually happened. So had they built a community center? Was there an improvement in indices of multiple deprivation? Was there a school that was open to the community to go there for events? Suggestions had been made in the health impact assessment on the importance of culture for mental health. Were there any initiatives? And I mean, interestingly, what I found in both cases, most of what had initially been agreed on was eventually implemented, was built, but with delay. And, well, it was lost sort of the track between the initial discussions and then what was actually happening. But this gave a totally different picture than looking at actual development, which was quite positive to see. There was public, an outreach worker had been sort of one of the ideas that was in the original document. This person was actually in place. For the new town, there was the council, there had been elections. There was a series of cultural events that were happening. So that was quite positive, opposite to what we initially thought based on the interviews with the people that had initially been involved in that.
That shows the significance, I guess, of retrospective work and also kind of looking backwards and evaluating effectiveness after a decent period of time has actually passed. But what lessons can we draw from those examples for practice today?
Yeah. Well, planning, tools like impact assessment are under a lot of pressure at the moment. people say they are not effective. And it's interesting. So initially, when we did the interviews, that was sort of the picture that we were getting. Well, was it effective? We don't know. It was perceived very well at the time, but we can't really tell because we lost track. A really important lesson is that maybe due to institutional memory, but things were eventually implemented and in the way they were stated in the original document, even though the link wasn't really made anymore. So, as you just said, it's really important, these follow-up studies, monitoring studies, to show that actually it's not as bad as many people make it look like. So that's one important lesson. Another important lesson was those initial HIAs, they were perceived as being very effective, very worthwhile doing, very beneficial, on the basis of champions really taking the lead and really changing something in the mindset of people that were involved. And well, as I said, what we found was that change seems to actually have led to positive changes later on.
It's good to hear. Thanks for your time, Thomas. Thank you for taking us through that. You can read more about Thomas's work and the specific study on Research Square, or you can find it on his profile or in the link below. Also, if you want to know more about Thomas's work with the World Health Organization, please do look up that on the website. Thanks for your time for watching.
Thank you.